Okay, hello everybody. Dr. Rapich here, Vet Triage, October 17, 11:47 a.m. Pacific Time, Thursday. We are working through this JAVMA edition, May 15, 2015, and we are going to be talking about a dorsal laminectomy for treatment of cervical, vertebral, stenotic myelopathy in an alpaca. And this is right up my alley as a neurosurgeon, so I'm excited to go through this paper. The study the case report is from the Royal Veterinary College, University of London, and the Camelid Veterinary Services in England. So this is an 11-year-old male, intact male breeding alpaca. He had a 2-day history of low head carriage and lethargy. On the examination, he had lethargy and low head carriage. They tried medical management, and he improved. But 8 months later, he had an acute progressive general proprioceptive ataxia affecting all 4 limbs and was referred for further evaluation. Let's start some things off right off the bat. General proprioceptive ataxia. There are 3 types of ataxia, just 3. General proprioceptive, vestibular, and cerebellar. Vestibular implies a problem with the vestibular system. So typically the vestibulocochlear nerve and associated structures, that'll cause vestibular ataxia. Cerebellar ataxia involves the cerebellum, and general proprioceptive ataxia implies pretty much anything else affecting the body in terms of brain, like central nervous system, brain and spinal cord. So vestibular ataxia, they have signs like nystagmus, head tilt, head turning, falling to one side, and then of course a vestibular ataxia, which is a drunken walk. Cerebellar ataxia, they have a hypermetric gait, so they're very spastic and exaggerated in their gait, and they can have other things too, like nystagmus and be off balance, but it's the gait specifically that makes their issue. And then general proprioceptive ataxia implies a disconnect between the brain and spinal cord to the limbs, and so that is a floating type of a gait where they're slow to reach the ground with their legs because they don't know where their legs are in space. They can't gauge how to put their foot down to contact the floor because their body is not recognizing that association. So they performed a magnetic resonance imaging, which is MRI, and computed tomography, CT, and they found there was disruption of the normal bone structure of C7 and T1. C7 is the last cervical vertebra, T1 is the first thoracic vertebra. They performed a dorsal laminectomy, C7, T1, and resected the ligamentum flavum. 6 months after surgery, he was successfully breeding with 7 hembra bred in the first year after surgery. Hembra is any female animal, producing 6 crias, which is the name for baby alpacas, and 4 crias in the second year. He was then euthanized 28 months later because of neurologic worsening, but he was still walking at the time of euthanasia, and they diagnosed in this alpaca a cervical vertebral stenotic myelopathy. So let's go into the details of this case. Alpaca, the genus and species is Vicugana pacos, Vicugna space PACOS. They ran blood work initially, which was normal. However, the alpaca did test positive for mycoplasma hemolymph, and they treated the alpaca with IV fluids and oxytetracycline, which is an antibiotic. There was improvement. Then the alpaca came back. Repeat blood work was still normal. They then collected radiographs of the cervical spine. They found collapse of the disc space at C7T1. I'm going to show you a picture of the x-rays, and sclerosis of the vertebral end plate, as well as proliferative new bone on the ventral aspect of the vertebral bodies of C7 and T1. And all this speaks to a compression of the disc at C7, T1, and secondary degenerative joint disease, basically arthritis, affecting the spinal cord and the nerve roots in that region. They tried medical management of strict rest, no bleeding, meloxicam, which is a non-steroidal anti-inflammatory. 2 weeks later, they performed an MRI, and they did anesthesia with methadone, xylazine, propofol, sevoflurane, oxygen, and they found that there was a hypointensity of the adjacent bone tissue in all sequences. They suspected a septic process because of the amount of remodeling that was present. So first off, here's the x-ray. And I tried circling there, right here, the area. So this bony proliferation, that's vertebral bridging spondylosis. And you can barely see the disc space here because it's collapsed. Whereas over here, you can see the disc space, that line right there. So in this area, C7T1, the disc space is gone, and there's sclerosis. Sclerosis is just an increase in bone density. So that's all arthritis and probably a herniated disc. So they did the MRI and thought maybe it was a septic discospondylitis. So they started an 8-week course of ceftiofur and fluorphenicol, and the patient was still ataxic, but it went from a severe grade to a milder grade. But then 6 months later, he progressed further. They did an MRI. They saw that there was further disc collapse, displacement of the spinal cord to the right owing to lateral bone formation on the left of the vertebral canal. They also performed a CT scan, found proliferative new bone, destruction of the normal bony structures, collapse of the disc space. So then they went to surgery, dorsal laminectomy, which I've performed numerous dorsal laminectomies in dogs. The nuchal ligament was not separated longitudinally, but reflected to the right of midline. The nuchal ligament is a ligament that goes from the occipital bone region, so the back of the skull, to the dorsal portion of C7 or T1. I don't know how in alpacas it's organized, it's structured. It may even go more beyond that. I'm not sure. But ideally, you don't want to sever the nuchal ligament because then they literally can't hold their head up after surgery. So they just moved it. Separating the dorsal musculature to get to the spinous process of T1, and they removed the dorsal portion of T1 with Ruskin rongeurs and Kerrison rongeurs till they got to the level of the articular processes. Dorsal laminectomy was also performed with pneumatic drill and a burr. For anybody who's interested, I do have videos on this channel regarding cervical myelopathies in animals, so feel free to look up that as well. Additional bone was removed from the left vertebral pedicles of C7 and T1 with the burr. They resected the ligamentum flavum. Ligamentum flavum is a ligament that is underneath the roof of the vertebral column bone above the spinal cord. So if that's inflamed or has scar tissue or it's thickened or whatever, it'll cause compression of the spinal cord. Then they resected the they cut through the dura mater. Dura mater is the very thin lining of the spinal cord. It also covers the brain. And I imagine that's because they wanted to decompress further. And they placed bovine collagen sponge. Right off the bat, I have a problem with this because it seems the dorsal laminectomy, if it was spanning C7T1, it probably should have been extended further to really go probably from the mid portion of C7 to the mid portion of T1. I'm thinking, obviously depends on surgery, but that's my first thought. And then my second thought is there's no biopsy or culture. If you're going to rule out a septic process or even cancer, I would get a biopsy of the affected bone and I would get a culture of the affected bone and see if you're growing any organisms there. That to me is a huge weakness of the paper they don't address. So here's the MRI. And what you need to know is the portion here that I circled. So you can see it's pretty similar to the X-ray where you have all this bony remodeling and the collapsed disc space and the sclerosis of the bone. You can appreciate how dark and messy this looks compared to the adjacent vertebra. And then here on the cross section, so this is the side view of the spine. So that gray tube, this gray tube here is the spine. Sorry, this is hard to do backwards. And then the spinal cord here on the trans section is showing that the articular set on this side where I circled is darker than this side. And so it has bony changes to it. And then when they did the follow-up, this is a CT scan, and you can see where I circled all that increased in bone intensity and spondylosis. And then on this side, all that missing bone and portion of the ventral part of the disc. Because if you look at this, the disc actually itself is hydrated. It's still bright in color, but on the MRI it was not. And so, the question is like, was the disc herniation problem, or was this truly a discospondylitis of the end plates of the vertebral bodies that then collapsed the disc space, or what? Because they didn't mention here, and I don't really see a marked amount of disc herniation here, because this is the spinal cord, this gray circle. So there's a little bit of a bulge there, but it's not crazy. So you wonder if it was discospondylitis that caused the collapse of the space. But we don't know because they didn't biopsy and they didn't collect a culture. So discussion, degenerative disease is possible. Discal spondylitis was the primary rule out. In humans, aggressive treatment is imperative, as spinal cord compression from discal spondylitis causing paralysis for over 24 to 36 hours before treatment can be initiated will result in permanent neurologic dysfunction. Acute forms of discal spondylitis in humans, horses, and cattle have been managed with medication. More advanced disease, the bone and ligaments remodel, has been described in humans and horses, and it causes spinal cord compression. The dynamic component in this case was not performed. What that means is when you collect an X-ray or an MRI or a CT scan, how do you know the compressions you're seeing there is actually what it is? Because if the neck is straight versus flexed versus extended, that's going to change the way the ligaments, the disc, the spinal cord, the nerve roots, the bone, the joints rather, everything's going to change in position. It can make a compression look worse than it really is, or not as bad as it really is, through that range of motion. So we used to do different views, but the problem with that is, number one, there's a lot of subjectivity to that. Number two, you can make the patient worse if you cause a further compression of the disease, the spinal cord from the disease. So there's ambiguity in the diagnosis of clinically important compression of the spinal cord on a myelogram following cervical flexion and extension. The procedure is not without risk of neurologic decompensation. There is an 11 to 16% reduction in the cross-sectional area of the vertebral canal as expected when the neck is extended in normal people because of soft tissue enfolding. So it causes a natural compression when you go like this in humans. Extension of the vertebral columns, that's stretching out the neck. Weird. Extension of the vertebral column has been shown to increase the cross-sectional area of the spinal cord in sheep, dogs, and pigs. So if you take the neck and you stretch it, that smooths out the spinal cord, it relieves the compression. Because of the risk of iatrogenic decompensation with flexion extension, traction is a technique of choice to figure things out between dynamic and static lesions in dogs, but it hasn't been standardized. And comparing myelogram to MRI, it's been shown that the diagnostic technique is highly subjective in dogs. In horses, myelogram is unreliable for localizing the site of compression. A hemilaminectomy is another spine surgery that I have a video of in this channel if you want to check it out. And they thought that the visualization with a hemilaminectomy would be inferior than a dorsal laminectomy, and that's been the case in dogs as well. Ventral decompression is commonly performed in dogs that have ventral compressions, but there are complications in dogs, including instability of the vertebral canal with extensive bone removal, and there's also a risk of bleeding with penetrating the vertebral venous plexus. The dorsal laminectomy technique has been shown in horses, but it has a high morbidity and a low success rate. I could not imagine doing a dorsal laminectomy in a horse. If you do it in a large breed dog, it's already a problem. It's such a pain in the butt surgery. This technique has been used for removing intramedullary or extramedullary masses or lesions, such as cancer or hypertrophic dorsal lamina and abscesses in horses. The procedure is not widely used because it's complex and requires a lot of time and the risk of complications after surgery, which include compressive hematomas, fracturing the articular process during recovery, and suppurative meningitis. And you can imagine, if you've never seen a horse recover from anesthesia, it is scary because they're just wobbling everywhere, and they're loopy. They're coming out of anesthesia. Well, it's not safe for people to be around. You can't maneuver that horse, and so they're in a large padded room where they're just falling everywhere. And you just did spinal surgery on their neck, so they can cause some major problems. In horses, vertebral stabilization is routinely achieved with vertebral interbody fusion via a ventral approach with the horse placed in dorsal recumbency. They use a purpose-made kerf cut cylinder or a locking compression plate. And what this does is it stabilizes the area that you've just decompressed to help strengthen it. There was a report of a calf with a spinal cord epidural abscess diagnosed by plain and conscious MRI that was treated successfully with dorsal laminectomy. And that was at C3, C4. Indirect decompression has been used with vertebral distraction techniques for dogs and for horses. So if you were to extend the neck, like we said, it can relieve the tension, the compression. But also, if you do that, you have to figure out a way to make that permanent. distraction and stabilization would not have been immediately addressing the static compression in the alpaca. So if you traction them, you have to stabilize that, right? And so you put an implant or an artificial disc or something like that to keep the area distracted. But in this patient had static lesions with all that arthritic changes and septic processes potentially. So it wouldn't have fixed that. It would have just fixed like the ligament problem, because that's more of a dynamic issue here. And there was no evidence of instability in that patient, in the alpaca. It has been suggested that increase in ataxia due to short-term instability in the vertebral canal induced by surgery. That's true also in dogs. We question this theory and suggest that reperfusion injury following relief of a chronically compressed spinal cord might be the reason. And I agree with that. I think that we underestimate how powerful reperfusion injury is. Reperfusion injury, for those who don't know, if you have a chronic compression, meaning a long-lasting compression of anything, so let's say in this case spinal cord, then you all of a sudden release that pressure off of the bloodstream. You end up with a rush of blood. Well, when that happens, the rush of blood causes what's called oxidative damage, which is from reperfusion injuries. So reperfusion means that the vessels are perfusing again, and oxidative damage is a sudden rush of oxygen that the cells try to accumulate, try to cope with, and it creates toxic byproducts. That's the simplest way that I can explain it. And reperfusion injury in spinal cord issues, I think, is grossly underdiagnosed. It's difficult to confirm. We used to give polyethylene glycol, PEG, to dogs before and after surgery to scavenge the oxygen free radicals, but I haven't seen in my experience that it actually works. So we'll see. All right. Thanks everybody for joining. We'll be back tomorrow, October 18th, for another one. See ya. Bye. 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 Bye.